You know, police have become the default first responders for pretty much anything, firefighters too, especially those experiencing mental health crises. But that is changing in one city in particular. In St. Petersburg, Florida, the city council approved a contract to launch the Community Assistance and Life Liaison Program pilot. The goal is to improve the response to mental illness, poverty, and addiction. Since February of last year, the program helped more than 3,000 people. And get this, suicides are down 20%. Can you imagine if all of our cities saw a drop like that? Police Special Projects Manager Megan McGee and licensed mental health counselor Nicole Gincho are joining us live right now. I think one of the biggest issues is that more and more cities are seeing people call in. There's this rise in mental health calls, particularly among homeless populations. Many people just calling 911. Then you have firefighters and police tasked with responding. But have you found that this is adding a whole lot of pressure to first responders?
Right. One of the reasons that we wanted to pursue this type of program was to really divert these calls and future calls from law enforcement, because they do have so much on their plate. And it's a better outcome for the person served to receive this type of service and repeated follow-up from a mental health professional.
Nicole, can you tell us exactly what is done when someone calls into this number now and gets a counselor? What types of resources are provided?
Sure. So our navigators and a clinical supervisor respond right away within 30 minutes or less. We go to the home or where the call is coming from, and we do a full assessment. And I think the key to this program is a lot of times it's getting them to their first appointment. They get lost in the system when they're waiting to get to their first appointment. So our individuals, our staff, keep them on hand, and we do a warm handoff to that initial visit, and we continue to support them long after the initial 911 call.
When it comes to the difference between someone who's having a mental health episode, something that can be addressed either clinically or through counseling or even through medication, versus someone who is a danger to society, how are, and Megan, maybe you can answer this one, how are these counseling services and law enforcement working together?
Right, absolutely. Safety has been a huge part of this program, from the development of the model through the implementation to every day. So navigators, by the time that they have received a dispatch to respond, that call has been vetted through our emergency communications division, through a supervisor, and then a supervisor also on the call side. So they are non-violent, non-criminal calls for service. The navigators respond in pairs. They can also refuse a call if there's any type of concern that there could be safety-related issue. We've had 0 incidents, and ultimately the call team is responding to 95% of their calls without law enforcement. But if they do want law enforcement to meet them at the scene, that is absolutely something that we accommodate and we see. So they are able to work together on the scene, and our officers are also able to make a referral to the call team if they have responded to a home and they feel that that individual or that family may benefit from some additional wraparound services from the call team.
I know we only have 30 seconds left in the show, but you can go to police.stpete.org/call, police.stpete.org/call for more information. Megan and Nicole, thank you so much. I hope that this program at least gets a little more traction. Maybe it's proven to be something we could see nationwide. That 20% reduction in suicides, certainly something to smile about. Thank you both. Thank you for being with us.
Thank you.
And thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.